We're here at the HIMSS 2018 conference at the Lenovo booth with Wyatt, Yelverton, and Andy Nieto. Welcome, guys.
Very good. Thanks for having us.
Yeah, it's great to be here. So you guys here at Lenovo have some incredibly transformative technologies that are being adopted across all of healthcare. What's really pushing these transformative technologies and making us need these new technologies that can improve healthcare?
Absolutely. So what we're seeing is a greater expectation from our patients in particular. Understanding that they are able to engage their physicians in the hospitals and really be a participant in their care no matter where they happen to be. So if it's in a clinic, we understand well what devices are necessary, but then we're also elevating how it is that we can deliver care in those environments. But it doesn't just end there, it's the real ability to take that care and take that engagement and move it outside of those facilities such that a physician, a nurse, a care plan manager are all part of that patient's lives no matter where they happen to be.
Awesome. So what are some of these solutions that you're offering? Let's show some of the stuff. I mean, you have this one here, right? Maybe we start with AR, VR?
Yeah, so augmented and virtual reality is one of those technologies that everyone's been talking about for a long time that really is a buzzword, and people have been thinking that it is emerging technology. These technologies are here, they're making a difference in patients' lives right now. And this is just one example of how VR is really coming to a patient and coming to the health systems where and how they need it. So this is an all-in-one device ultimately that can be loaded with content and delivered straight to a patient, or think about in a hospital atmosphere where a patient is in a room setting. We don't want to make things more complicated for them. They're actually able to take this headset to the patients to provide them education, to provide them diversion and distraction away from the traumatic environments of the hospital and ultimately what is afflicting them in that moment.
And what's the approach to integrating these into a healthcare organization? Is it led by the CIO? Is it led by the chief medical officer? I mean, what are you seeing in that regard?
We're seeing it all across. Obviously, the CIOs are going to be interested in the value of those technologies that they can bring into the hospital and ultimately what it's going to do for an ROI. But at the same time, we're seeing the need come from nurses, from the patients themselves even, where they're having experience with these technologies outside the hospital and they're asking for it within those facilities. Especially when we think about augmented reality that's now enabled on your phones, everyone carries one of these with them no matter where they go. It makes sense that we're able to take that emerging technology and put it in the hands of our physicians and our patients today.
Right, and I think that's one of the most exciting things is that before this was kind of sci-fi, almost mythical, you'd read it in a book or you'd see it in a movie, but now it's reality. I mean, people are actually using this. I heard one person say the science between AR and VR is very clear. It's beneficial to help with pain, it's beneficial to help patients, but we just need to figure out the right process to incorporate it.
Exactly right, and that's what we're trying to work through right now in understanding not only necessarily how we integrate the technology itself into our environments, but how then we begin to socialize it with our patients and set expectations on how we're using it from a clinical standing, and then how they can then translate that into their own lives. So we're working through some of those practical challenges, but ultimately what we see is that even the simplest of use cases, even the most straightforward of using these devices for entertainment or for education, make a lot of sense. So we are able to start simple, we're able to start in a way that makes sense, and then learn and grow as we move forward to develop that history of use.
Well, that's great, and I mean, customer satisfaction scores are huge, right? The HCAHPS scores, and maybe what increases that HCAHPS score is that I had an entertaining experience while I was waiting and suffering in the hospital, right? I mean, that's really
that's exactly
neat.
it. Yeah, and that's the simplest way for us to be able to communicate to our patients that we care about something more than just their diagnosis. We need to help involve them in the process of care, and this is a simple and straightforward way to begin doing that.
Awesome. Andy, what other technologies do you offer? I mean, AR, VR is exciting. What else are you working on?
So we have a number of different focuses around home health, how we engage the patient where they live. We know we receive treatment in a clinical environment, but once you move out of the clinical environment, you have to heal, you have to begin returning to your daily life and focus on your wellness and your health. So we have things like our Smart Dock and Smart Assistant Home, where it becomes a hub to connect your personal wellness devices, your personal therapy devices, and exchange that information with your care provider, really extending the location of care and healing into the home. it's that engagement in the home that really differentiates our approach. It isn't simply about empowering the provider or empowering the clinician. It's empowering the patient to really be an active participant in their recovery of health and their return to their lifestyle that they desire so much.
Well, it's pretty neat, and I think smart assistants are so powerful. I mean, we've seen the explosion of smart assistants. I think my kids, they don't Google anymore. They ask, some smart assistant to tell them the answer. They don't know what Google is, but of course the smart assistant's using the knowledge base out there, so that's pretty neat. But what about the security considerations? I mean, I think that's something that many of us worry about with the smart assistant, especially in the home, right? What are your thoughts on the security and what you've done there?
I think we absolutely have to address security, both from the idea of protecting PHI, and we have to address security from identifying the individual user. One of the things we've looked at is how does Lenovo extend patient identity and that security all the way through the system, whether they're in the hospital, all the way to the home. And when grandma has her grandkids over, if they're talking to the smart assistant, does their information get in grandma's records? So how do we identify that individual? Wow. Identity is a real key component of security, and we're addressing it through a couple of different partners and identifying different sensors specific to individual users. We're also working with our partner LifeMed ID to try to find different avenues to identify a patient, whether it's using a smartphone and taking a picture of your face and saying, I am who I say I am, and so when I connect to my smart assistant, we have something like that. So there's a lot of different avenues we're working on that. We've got a couple of other really cool things coming down this year that are really going to highlight security and extend that opportunity into the home.
Yeah, that's really neat, and I love the idea of the identity, because that's such an important thing when it comes to security and privacy, but also when it comes to the quality data that's stored there. You don't want to have the smart assistant ask your grandson, are you healthy? And they say yes, and you're like, wait a minute, no, she's not. that would be an issue, right?
The smart assistant is such a powerful device. One of the things we were looking at is one of our teammates has an 81-year-old mother who's having some challenges, and we're really finding that if there's something that she can be very comfortable with, she understands her TV and she understands how to speak and she understands her telephone, so how do we extend that interaction to something that they're familiar with?
That's really neat. And you mentioned the partner side of things too. I think that's a really important thing for Lenovo, right? Because you're not opening a home health service, right? You're probably not going into the hospitals, maybe, right? What's your approach to partnerships and finding the right partners for AR, VR, but also the smart assistants?
Well, the partners are really what are able to make it happen, in the sense that we know what we do well and we have some ambitions to be able to move beyond that space. But we also recognize that there are simply things that we can't do as well as other individuals, other companies. And that's really where we want to embrace the best of what's out there, to bring a solution to market that really is cutting edge and of the highest possible value to our providers and to our patients. It's not just about getting something else out there, it's about integrating in a very wholesome way our products and our services with the very best of what's out there, and truly being able to meet the needs of our patients and our providers where they have them.
Sure. Well, and it takes a whole community to do it.
It really does, and that's one of the reasons that through our whole alliances and our partnerships, we also vet our partners to ensure that they do have the quality to deliver, that they are recognized in their industries as specialists, and that what they're delivering meets our standards and is elevated to our expectations.
Interesting. What about another thing? I know you guys are doing some work in the telehealth space, and I think you have a hub or something. Can you talk to the telehealth side of things?
We have a couple of different hubs right now that are really impressive. One is our Smart Hub 500. It enables telecommunication from really any device that has an HDMI interface. We also are working with our Alexa-enabled Tablet 4 Smart Hub. We actually have one of it right over there. We can show you a little bit. And it really brings together the Alexa, that voice interactive with smart response, with our tablet. So the tablet can be removed or connected, and it acts as a hub into the entire environment.
That's so impressive. I actually started the music on my tablet instead of my Alexa device, and I was listening to it and it got to a song I didn't want. I said, Alexa, next. I was like, oh crap, it was my tablet, not that. I was so angry. I mean, I've become so habituated to doing it. And so.
But that's a complexity that shouldn't exist. especially when we think about putting multiple medical devices in someone's home. We don't want them to have to think about what device is connected with what system and how it is that they need to use, whether it's their glucometer, their blood pressure cuff, or any of the other devices in their home, either for their clinical use or for their personal use. We want all of those to create one seamless environment for them ultimately to get the very most out of those devices and that environment. So ultimately what we're trying to do is reduce the complexity and then provide the highest value back into the clinical system so that we create actionable insights as well.
Yeah, that's great. Well, we're here at HIMSS 2018, and for the last half a decade at least, EHR vendors have dominated that. And the question with a lot of these devices is, how do you integrate it with the EHR? What are you guys doing as far as integrations with EHRs or other kind of legacy systems?
So we see our EHR partners as a critical component of how we deliver information, how we deliver connectivity. So we have an entire team that's dedicated to communicating with our EHR partners and also with the standards bodies to say this is the way information is to be delivered. We then leverage that to make sure that our resources and our tools are empowered to deliver it in the expected ways. There's a number of different standards bodies out there that are defining whether it's a CCD or whether it's an HL7 design or FHIR interface, and what are the expectations. We simply empower the delivery of those particular parts. Additionally, we've been talking directly with our EHR providers and our EHR partners to say, what are the expectations for next year and the year after next? Where are you going? What does the interface need to have? If it's a tablet, is there a certain size? Is there a certain touch? Are there certain motions? I can remember back when the idea of pinch to zoom was new. Right now it's an expectation and standard. What's next and how do we get there?
Impressive. Well, I think a lot of people that are going to be watching this are going to say, I would love these devices. I'd love to have smart assistants in my exam rooms. I'd love to have some VR to help the patients. But I have a real challenge justifying this to my bosses. So, how do you approach that justification piece with CIOs that are like, yeah, let's do this. What's the value that's created?
Well, the really nice thing about most technology across the continuum is that the costs are really coming down. We're able to get more for our money now than probably ever before, and especially when we think about sheer edge compute with respect to mobile processors, to memory and storage capabilities. We're really getting a lot more multifunction capabilities out of our devices, and as a consequence, those devices then can be leveraged in multiple environments. We don't have to repeat them over and over again, no matter where those physicians or nurses or patients happen to be. But then at the same time, one of the true important elements within Lenovo is being able to capacitate all organizations to participate in the very highest levels of technology enablement and implementation. And part of that is additional delivery models, being able to package not only the hardware but the services, the support, so that we, the technical experts, can really help you, the organization, manage those devices and implement it well through an as-a-service delivery model. So it really brings down the cost of actually deploying those devices and allows you to use them in the ways that get the very most out of what they are intended to do.
Right, plus if you're in rural Wisconsin, you probably can't find an AR expert to come and hire, let alone could you afford one, right?
Yeah, exactly.
Absolutely. The other component of that we really are excited about is how solid virtualization is now, and the ability to deliver to mobile devices, to different end user compute devices that are lower cost, the higher level technology, because we're virtualizing the space out there. It also gives us power over the security, control of the data, protection of that PHI, yet empowerment and enablement out in the field. So if you're in rural Wisconsin or you're in the Rocky Mountains and you need that particular provider, you can get to them in that virtualized environment, still secure, safe, and empowered.
Awesome. Well, thanks so much, Wyatt and Andy. I really appreciate your insights, and thanks to all of you at home that are watching on healthcarescene.com. If you enjoyed this content, check out our YouTube channel and all the great content at healthcarescene.com.